In this session, we had a look at risk of bias tools in research. So let's go.
Before you bring in anybody into your household, or before you bring anybody into maybe you're trying to fetch somebody, like what I mean by fetching somebody, you're looking for an employee, or you're trying to employ, or you're trying to bring in somebody into your organization, or trying to get married, right? So one thing is very paramount, and that is risk of bias. You always want to know the type of quality the person possesses, if it's something that is going to, if it's something that is worth it for you, or that entire process. So this is not different from what we do in research. We do it in our everyday life, where we screen people, we take out the toxic people, and we leave our circle with people who are very positive to what we want. But it's not different from what we're doing. What we're doing in systematic review and research is, before we include studies, we've set out our inclusion and exclusion criteria. If you're not listening to that, you can go back to a previous episode or our previous session and watch it. And we've talked about search strategy, study selection, and all that. Another thing that is very important is the risk of bias. It's always very important for us to discern the risk of bias of those included studies before we can include them. So for tonight, we're going to be looking at this session we're going to be looking at it from a couple of headings out there. First of all, we need to understand what is risk of bias, what is the importance of risk of bias in systematic review. Then we'll discuss what are some of the type of bias that we can actually encounter while we are doing our systematic review. Remember that we didn't just start talking about risk of bias. We started by following the domains of the Prisma flow diagram. So there is always an area in the Prisma flow diagram where you have to account for the risk of bias. So then what are these tools? What are some of these tools? Then we'll now look at some of the step-by-step guide in conducting a risk of bias assessment. So we wouldn't really go into the full detail of practical, but what we need to know is what are some of the basic approaches that you could use in ascertaining that. And we'll have a look on the case study, and we'll take a look we'll also listen to some of the strategies that we can use in reducing and minimizing bias. And also, remember that we talked about the systematic review being something that is performed by more than one author. So that implies that we need to know the best practices that we can use in reporting the risk of bias in systematic review. So it's going to be a very juicy and understanding session and episode out there for us. So yeah, we're asked to start for risk of bias, and we'll just have to continue. So now when we talk about risk of bias, what do we mean? Remember that let's look at the word risk of bias. Now, when we talk about bias, what are we trying to say? Bias could be anything that is any source of error. So it's more a risk of error, risk of overcoming any error. So I think that sounds very nice, and it's something very pleasant to the ear. So when you say risk of bias, so bias is just any type of error in research that can actually impede on the result. Remember that when we define research, we explain research as the science of new findings, scientific process of new findings. So that means anything that can distort that findings is what we address as what? Bias. So that means when we are performing systematic reviews, we've got to include studies from diverse papers or primary studies and all that. So it's very possible that we should recognize the type of studies that we're including and know the type of accuracy that these studies are reporting, so that we don't find ourselves plunging into bias. So that is just what this particular explanation is trying to look at. So when we look at risk of bias, is that trying to make sure that in systematic review that we recognize and we account for any type of bias. So what could this bias be? So it could be bias that could be shown in various stages of research. So let's take, for example, you just started your research on prevalence of malaria in Nigeria. So that means while you went out to collect samples from people, maybe during your design, there were certain things you didn't report, and you not reporting all those things or not performing all those things could lead to bias. Let's say you just put up your questionnaire, you didn't really give it to your supervisor to check, you didn't perform any sort of validity, then that means there could be bias because you just came up with a couple of questions for knowledge of malaria and you're asking the participant. Then in that scenario, there are likelihood that you might not be asking the right question, and in that situation, you might have the wrong result. So this is just a practical example of what bias could mean in a primary study. So our ability to ascertain the risk of all these challenges or all these errors in why before including that primary study in systematic review is what we call risk of bias. So I think that's very simple to a 9-year-old boy who is with his dog. So what are the importance of risk of bias in systematic review? Remember that in our previous session, we did mention that systematic review is at the top of the hierarchy of evidence. So when you look at some of the Pollitt and Beck hierarchy of evidence, at the base of it is usually what we address as the opinion of some of our experts, right? So it goes up to in vitro research, animal research, case reports, cross-sectional studies, case control, cohorts, RCTs, and systematic reviews and meta-analysis. So this is just we saying that for a systematic review to be conducted, it needs to be of high quality. So those primary studies or those studies that are at the base or that tend to be lower in the hierarchy of evidence that is going to be included in the systematic review, they need to be well polished. So in order to ensure that these biases don't distort the results, and in a situation whereby your systematic review results is being distorted, then that means your conclusion can be misleading because you're including studies that are not really worth it. So it is just all about avoiding flawed conclusions that could impact clinical policy decision, because we all agreed in our previous session when we talked about overview of systematic reviews back a couple of weeks, we did mention that systematic review is tailored at informing clinical practice and decision making. So in a situation whereby the systematic review papers are not properly screened for bias, then it could actually do what? Impede on what? The evidence, and it might not provide an accurate synthesis. So these are just the important. This is why it is very important that whenever you're conducting your systematic review, you must choose a quality assessment tool that you use in grinding and screening the papers that you're going to include. So we'll have a look at some of these various papers. So what are some of these types of bias? Now, so one of them could be what? Selection bias. So when we talk about selection bias, so it's a type of bias that can mostly, when remember all these biases that we're talking about here are all more likely to happen in a primary research. So what we are saying now, the point now is that remember that for us to conduct a systematic review, we need to include the primary research in our synthesis. So it means that we need to acknowledge all these biases, right? So some of these biases in research now could be, first of all, it could be selection bias. So that means when you're doing your primary study, so it's possible that it occurs when participants are choosing for a study that aren't representative of the broader population. So, for example, let's say if you're doing a drug study now that includes young adults, but it's meant to apply to all ages, then let's say the study is supposed to be for all categories of population, but you now include only young adults. So that means when you're now making conclusions for everybody generally, that means it might not really apply for what? Older adults. And remember, the type of biases that we're discussing here, they form the domains of what we call the Cochrane risk of bias tool. We're going to explain that particular tool. But it's very important we understand all the elements of these particular words, risk of bias tool. Now the next one we have is what we call the performance bias. So what do we mean by the performance bias? So it happens when there is a difference in the care provided to different groups. So in a study on exercise now, let's say one group gets extra health coaching while the other doesn't, and that means the result might favor the groups that are being coached. So another thing could also be the detection bias, right? So most times this is related to how outcomes are measured or assessed in the study. So it's just like, let's say now if the doctors now knows which patient received the treatment, so they might actually unconsciously rate improvement higher in those questions. So we're going to have a clearer look of what this means with a practical example. Now let's look at another one, which is called what? Attraction bias. So attraction bias is also another type of bias we can actually encounter in systematic review. And that is what, particularly when participants drop out of the study and it's uneven, they're just dropping out. So let's say in a long-term study now on weight loss. So if more people are dropping out of the control group, that means it means that the treatment group may appear to be more effective than it actually is. So the point now is that what is now the need for the what? Comparison. That is already what? Bias. So reporting bias too is another one that is largely common among so many of us who are researchers, where we only report the parts that we're interested in, and we're not interested in the other part. So it's largely common. So for an example, it's just like a study that might only report improvements in mental health, but it will not talk about the side effects. And the last one that we'll look at here now is the what? Publication bias. So publication bias now is just when studies with positive results are more likely to be published than those with what? Negative or no results. This is something that commonly happens. Whenever there is something of impact, you get to see them more published than others. So if a treatment is tested in 5 studies, but only 2 of the studies with positive results are published, it may seem more effective than it actually is. So in that situation, the remaining 3 that are not published now, we are not now known. So it will not be that based on the 2 that we are seeing, that they are more effective. So don't worry yourself. All these things are just several biases that we will look at. And I want to tell you something, that some of these biases that I've actually looked at are more synonymous with intervention studies, particularly when you're doing a randomized control trials or you're doing a systematic review that requires you to include randomized control trials. These are domains that are more likely to be there. So somebody might ask, how about, let's say we're including cross-sectional studies? What type of biases we would be looking at? There are lots of them, and they are very simple. First of all, it could be, was there a clear title? Maybe title bias, methodology bias, data analysis bias. It could be anything you have in mind, right? So all I'm saying is that all these biases that we've looked at, that we've just explained, attraction, reporting, publication, selection, performance, are mostly related to the domains of what? Interventional studies. So where does this lead us to now? It leads us to the fact that for you to perform any systematic review or any type of systematic review that is going to include various designs, we need to understand that each design has its own unique risk of bias tool that will be used. And that brings us to this part of it, where we'll be talking about some of the tools for assessing risk of bias tool. Now, we have several tools. Remember, I talked about the Cochrane risk of bias tool, and that is just the tool that we just looked at. Its domains: selection, performance, publication, attraction, and all that. So it's used for randomized control trials. Remember, I just said that, which are interventional studies. It evaluates 7 domains. We also have what we call the updated risk of bias tool by Cochrane. We have the Robin scale, which is for non-randomized studies, right? And we have the QUADAS, which is for diagnostic studies. We have the CASP. We have the Pedro scale. We have the Axis checklist, which is used mostly for cross-sectional studies. So meaning that when you selected your studies, and they are now largely cross-sectional studies, what will be the likely checklist for you to use? You will have to use the what? Axis checklist, which is for cross-sectional studies. So now the Newcastle Tower scale is used mostly for what? Cohort studies, right? So let's say you've included cohort studies largely. What will be the most suitable checklist for you to use? It will be the Newcastle or Tower scale. There are lots of them actually that are not listed. We have the Eastbourne checklist. We have the Moons. Lots of them, right? So just get that done into you. Now I have a quick exercise here. And what would our exercise be geared towards? We'll be looking at some of these checklists. How can we have a look at them? So I'm going to open my worksheet. So I have already downloaded the links to this checklist. I'm going to share it. All you need to do is just to click on this, search it. Now, what are we going to be looking at now? we're going to be looking at some of the domains of this checklist. So I'm just going to click on this. I just copied that. Then I'll come here, I'll paste, and I'll enter. So automatically it opens the Axis Critical Appraisal of cross-sectional studies. Remember that I address risk of bias. You can address it as what? Quality assessment, you can call it critical appraisal, or you can call it what? Risk of bias. All of them are all what? Talking about the same thing. And now, what are we talking about? Remember that back here in our slide, we did see that what? Some of the domains here are selection, performance, which I did mention that they are more related to what? They are more related to what? The Cochrane risk of bias tool. Now, having opened the Axis tool, which we have here now, how are we now going to extract all the domains? And we're going to go down. So it contains what? 20 items. The Axis checklist contains what? 20 questions. So these are the questions we need to ask each of those studies. Were there ends of objective? Was the study design appropriate? Was the sample size justified? Down to the 19th, which we also have the 20th on them, which is representativeness, right? So all these are the what questions we need to pass that each of the studies were finally included. We have to pass these questions through them, so we can now rate them for their what? For their quality. We're going to have a practical session on that, particularly for some of the studies that we've already done what included. Now, does it stop there? No. We'll have a look at what the CAPS checklist. Remember that here I did mention that for the Axis checklist, it is what? It is largely for what? The Axis checklist is mostly for what? Cross-sectional studies. Now, for the CAPS tool is widely used for what? A lot of studies. So how do we get there? We click on this. I just copied that. I'm going to go to the internet. I'm going to come here. I'm going to click it. I'm going to open it. Now, by opening it, it brings me to the what? To the CAPS portal. So the CAPS checklist contains a checklist for what? Observational studies. Contains for what? Randomized trials. Systematic review checklist. Because we do have umbrella review. Qualitative, cohort, diagnostic, case control, economic evaluation, cross-sectional studies checklist, and all that. So now I could just decide to click any random one. Let me just click the randomized control trial. Now, how do I get the checklist? So I'm going to select what? The PDF. Now, automatically, it opens the what? The appraisal for me. Now, here are the appraisal. The same thing here. Did the study, it has the section A, which is the basic design of randomized control trial. Now, did the study address the clearly formulated research question? So it's up to me to say yes, no, or can't tell. Remember that the quality assessment is also being performed by more than two, or more than one reviewer to minimize what? Bias. So these are the domains. So I'm going to do that carefully. We talk about was the assignments of participant randomized. So you have to go through the article. So what does this look like? It looks like you just open, let's say, for example, I will search on data randomized control trial on diabetes in, I just searched a random article. So let me just open this. So I will just open this. Okay, cool. Okay, I'll go ahead to download the PDF. So I'll have a more clearer look. Now, what are we talking about? Okay, I'll close that. Now, what we are talking about is that for you to perform the quality assessment, it means that, let's assume that in one study, I randomly included this paper. So the first thing I'm going to do is when I come to the study address the clearly focused question, I'll go to that research. Maybe I'll go to the background and examine if there is a clear good, and there is. We hypothesized this. Cool. So I will now come to my table or my checklist and click yes. So we're going to also have a hands-on practice on this. Then I'll click yes. Then maybe I might want to look at this aspect of it. If I want to make comments. Now the second one is, now remember what this consideration here means is that these are some of the things you need to consider before you do what? You address that question. was the so was the design to assess the outcomes and intervention. So you check out these before you can be able to do what? Address that particular person. So the same thing also does what? Continues to do what? To apply. Now, so we've just checked for what caps. So somebody might ask, how about we look at another caps too that is not the RCT? So I'll go back there. So let me just click the cohort and see how that looks like. I'll come in and download the PDF as well. Now, you look at this question and you look at this question. See, they're not the same. So it means that this is for what a cohort what studies. So in that scenario, you've included a cohort study. You have to use all the domains of this appraisal to do what to address it. So I think I'm done with that for the caps. So the next two we're going to also look at is the Newcastle Tower scale. Click on this. Paste. So I've just downloaded them. So these are the questions in terms of selection, answer, truly representative, somewhat or none, and that down to this. Now it's also being rated. So in the situation whereby you select one, you might put, or maybe yes, you might put one, and so we're going to also explain this, don't worry, in details. For now, all we need to understand is that each checklist has its own what? Domain. So we go for the Cochrane. So the same thing applies for the Cochrane. Also, the same thing applies for the what? For the Pedro scale as well. And also for other what? Checklists. So let's just take a look at the last one, because already we saw the Pedro somehow in our. So this is the Pedro scale, which is used mostly for physiological evidence. So you see that the questions have changed. This one, it doesn't even start from in. It starts from eligibility criteria or specific. So you pick yes or no, all down till understanding the criteria as well. So I'll close that. So we have an idea of what all the tools are of practice. Now, the question now is, when we are conducting a systematic review, what do we need to do? It's already simple. And don't worry, we're also going to have a very detailed explanation shortly in our future episode. Now, an assessment typically involves, first of all, is to identify the bias domain. Just like we looked at in that paper, we did see that some of the biases, is there a clear, whether there is a clear statement of the question, or whether there is a clear, just basically all the questions that we are asked. Then the next thing we now need to do is to now rate it. How are we going to rate it? Right? We need to rate our risk of bias. Either we score it as 1 as, or we rate as what? Low or not clear risk. So we have several methods, and also how we can also do what? Interpret our results. So the question now is, what are the strategies that we can use in managing and reducing bias? First of all, we can reduce bias by double screening, ensuring that we screen for the papers clearly, ahead of the selection criteria or the selected studies. Again, it's clear criteria. We need to come up with a clear criteria for you to be able to manage your critical appraisal or your risk of bias or quality assessment. So also sensitivity analysis is important, because sometimes we might decide, what we call this is, we might decide to, when we look at some of the studies that are showing that bias, we might decide to remove the highest and the lowest. So all this will also explain in details also how to perform that. So what are some of the best practices for reporting the risk of bias? So first of all, it's important we use the transparent reporting process. The Prisma is still very vital. We can use the Prisma to record some of our process, and again, the tables is very, very essential in our practice. So I want us to list to take up some of these exercises. Very beautiful one. Now, what am I going to do now? I'm going to we're going to just have a very short look using one of our article, and we're going to rate it using one of the checklists. So let's pick up this first article. And I'm going to search it. Okay, cool. Now, when we look at this study, this is a what? A cross-sectional design. So meaning that let us use the what? The axis checklist to rate this study. Let's use the what? The axis checklist. And for me to do that, the first thing I would do first thing I'm going to do is to create the what? A table. I'm going to create a table. I'm going to create a table. Let me probably create a table of 19 domains. Then what am I going to do, which I'm explaining? Then I'm going to come to the axis checklist. So I'm going to go back there. Now, aim and objective and all that. Now I could come to my table and I could call this the what? So I could call that what? The domain. And this is my study, innocent at all 2022. Here in. Now I'm going to just pick out all the domains in this one checklist. Study design, sample size. So I'm going to just record that. I'm going to call this what? Okay. So this is how I'll continue. Now, just a snapshot of what we'll do, which we're still going to explain in details. Now, let's assume I now come to the 19th, which talked about what? Funding. So what now? Remember, when we come back here, we're trying to address how you can conduct it. So we've identified the domains, which is this from the checklist. So this is from 1 to 19 or 20, depending on the whether you're using the updated checklist. Then this is the study. Then we have it here by saying how to narrate the risk. So let's assume for all the parameters that are present, I might try to rate it as 1, or maybe I might try to rate it as clear, maybe unclear. How did I find out the M is clear? When I come to the article, I open the article. This is the PDF. Is there a clear M? Yes, there is. This is it. And it's also found in the full text. So this is it. Then I'm going to rate that as it is clear. Then in terms of sample size, I'll check out the article. Was there a clear description of sample size? We talked about sampling, but did he talk about sample size? Okay, total of 94. Did he talk about the calculation? Now you look at the domain and make sure you digest everything that is what required of it. So the target population, was it clearly defined? And all that if they were, let's say for example, target maybe here it could be unclear, for example. Then at the end of the day, we might decide to score this 1/20. Then here maybe you have other included studies like Ahmed 2008. You have so the same thing is going to apply. Let's say at the end here you've got 17/20, depending on how you rated it, and here you've got 18/20, and maybe here you've got 19/20, and you've got 16/20. Then at the end of the day, it's now up to you to do what. Remember that here, we now said, what is the net? How do you rate the risk? So it means you might not define your cutoff, where you cannot say rating. You can say from greater than 14 over 20. So that means 15 up. Then you now say from 10 to 15 equal to medium quality. Less than so this is what it practically means. But don't worry, we're going to also share detailed insight. I just wanted us to just have a tip of what this looks like. So I'm just going to have a rundown again. I'm going to have a rundown of what I've talked about tonight. I started by explaining risk of bias, the importance of risk of bias. I talked about the types of bias in research and systematic reviews. I did mention some of the step-by-step guide to conducting risk of bias. Then we talked about some of the strategies and best practices. So we explained risk of bias as any systematic error that skews the result or that tries to influence the result. And then we now made it very clear that systematic review, recognizing and accounting for bias is very important to ensure the accuracy. So that it's very, very important because if you don't include the risk of bias, how would we publish it? Because it might affect the what? Clinical and policy decisions. So we need that bias. So some of the examples are selection bias, performance bias, detection bias, attraction bias, reporting bias, publication, and lots of them also, depending on the domain of the checklist. So some of the tools, we have the Cochrane risk of bias, Robin scale, Quadas, CAS, Pedro, Axis, Newcastle Town, and loads of them. Then in the terms of our exercise, we did show some of the sites you can use in downloading your risk of bias tool. Then we say that conducting a risk of bias involves, first of all, set your domain and how you're going to rate your risk. That's the most vital important thing. Then interpretation is now, once the work is done, you will now do your interpretation. So what are the strategies for reducing bias, which you explained? We said double screening, clear criteria, and what? Sensitivity analysis. Then we also explained that some of the transparent practices that is very important for you to be performing your risk of bias of your quality assessment or systematic or whatever. It's very important for you to be transparent, try and use tables, just like as I've done quickly, and technically do very well. So it's with this that I wish us, it's a pleasure to have each and every one of us on this session tonight.